We can now go to Gaza to speak to Dr. Tomo Potokar. Good evening to you, Doctor. Thank you so much for joining me. It's a pleasure to have you on the show. You've described the situation in Gaza as horrific. Can you tell me more about the conditions you're witnessing on a daily basis?
Yes, thanks. Good evening. So, there's a number of things happening. One, we have a very dense population density because Gaza Strip, as you know, is very, very small geographically, and within that, there's approximately 2 million people. There's bombardments going on every single day. They start early in the morning, sometimes 2, 3, 4 o'clock in the morning, and they're pretty much continual on and off throughout the day. There's a huge amount of destruction of infrastructure. So I'm in Khan Younis at the moment, and many buildings have been destroyed and flattened. Because of the evacuation order this week, large number of people have had to flee. They're trying to flee to the al-Mawassi area, which is the so-called protected area, although, as we know, there have also been attacks there, and it's extremely overcrowded there and very difficult to find space. And then on top of that, we have the blockade, which means that people have been extremely hungry, been starving, been malnourished. So when you add all these together, we've got a huge displaced population, many of them displaced many times. They're malnourished. And on top of that, a lot of them are getting wounded and injured in this constant bombardment.
Dr. Tomo, given the destruction of the facilities like the burns unit at Nasser Hospital, how are medical teams like yourself actually adapting to the situation, and how are you able to treat patients and make sure that everyone is safe and also has nutrition to recover?
Well, the short answer is we can't. We certainly can't make sure everybody is safe, and we certainly can't make sure everyone has nutrition to the amount required. So what we can do is the best with what we've got. So yes, the burns unit was struck earlier in the week. So this had obviously a significant impact on being able to treat the patients there, because they've now had to be transferred to different areas across the strip to different, across the hospital, which means they're not all in the same place, which means it's much more difficult to look after them because you haven't got a dedicated team because they're spread out everywhere. We don't have necessarily the amount of dressings that we would like to treat these patients. So we can treat them, but we can't treat them to the standard which we would like to treat them, and not to the standards that they are used to in peacetime, for example. So it's not that we can't do anything. We have to do something. We cannot just leave these people, but clearly we can't do as well as we would like to, given the circumstances.
And you've urged world leaders to stop talking and to do something. Today, the UN chief has said Israel has only let in a teaspoon of aid so far. It's demanding more, but is just saying this simply enough? Should more actions be taken right now?
Well, I'm a surgeon, I'm a humanitarian, I'm not a politician, but I think, we can see the world over that there's a lot of people out on the streets. There's a lot of anger about what is going on. And I think there's also a lot of anger at world leaders across the globe, not just in specific 1 or 2 countries, but across the globe that come out with statements, often repeating pretty much the same thing. We condemn this, we condemn that, we demand that this must happen. But they're just words, and they've been going on for a long, long time, and nothing on the ground has changed. So I think there is, yes, people are feeling very much that the rest of the world is not really doing anything on a concrete basis to affect any sort of change here.
And Dr. Tomo, I'm just obviously listening to you speaking to me, and it's extremely emotional, the situation that you find yourself in and your team. On a personal level, how are you holding up? Are you getting enough support? And what do you need right now, you and everybody, your medical professionals?
Well, I mean, what we need is clear. We need a ceasefire and an opening for humanitarian aid. But that ceasefire has to then, lead to a permanent cessation of hostilities. Because a ceasefire for a few days or a few weeks, which is then followed by a further escalation in conflict, is just delaying the inevitable. So, the politicians and the diplomats and the various governments need to get together to sort that out. From our point of view, unless more food comes in, unless more humanitarian aid comes in, and unless the bombing stops, there's not a lot we can do. We're picking up the pieces, and the health system is extremely badly affected. I mean, many hospitals are out of action. There's no hospital that's functioning at its normal capacity. On a personal level, I mean, we as humanitarian workers, we come here for a relatively short period of time, and it's important that during the time we are here, we're focused and concentrated on what we're doing. And as you rightly said, it's extremely emotional when you see children wounded, seriously wounded, with life-affecting injuries, young people dying. It is very, very unpleasant, but you have to cast that aside for the time you're here to be able to do your job. And I'm sure none of the patients that we treat would want to be treated by somebody who's breaking down in front of them. So we just have to get on with the job. And also, for us, it's a relatively short period of time. For the Palestinians that are living here, they've been going through this for 20 months now.
Dr. Tomo Potokar, thank you so much for joining me, and you are definitely an inspiration, and thank you once again. It was a pleasure to have you on, and please do keep safe.
Thank you.